Hi, good morning Darren. My name is Mihiraa. I'm your invigilator for the OET speaking session on the 8th of March 2022. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Darren Sains.
And what is your candidate number, please?
My candidate number is 246309190.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Thank you. So let's start with warm-up questions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What do you find the best part of being a nurse?
The best part of it is that I'm doing something I love, and I get paid for it. I wouldn't exchange it for anything in the world. It's a highly rewarding career, in which I can directly help the people who need help the most, namely those who are in pain or have some difficulty in their lives. Being there for both patients and their families is a great feeling that I can't think can be likened to anything else.
How well can you cope with the advances in medicine?
The medical field has come a long way since the times when nurses have to maintain manual journals and jot down notes consistently. As technology advances, we nurses to upgrade timely. I am pretty familiar with the latest devices, systems, and programs associated with the medical sector, and can work faster, more accurately, and more efficiently.
What are some of the most important things to consider in the nursing position?
In simple and direct words, how not everything can be solved with a drug. We need to look more closely at what's happening with each patient and treat them individually. Sometimes, the words and care that we provide will be more effective and satisfying for the patients than the drugs given to them. That makes the nursing position challenging as well. Hence, it is the most important thing to consider in the nursing position.
How would you work with the charge nurse?
I understand the importance of working in alliance with the charge nurse. It is the charge nurse who coordinates, communicates, and plans the entire department. I would try to understand how that professional wanted to coordinate care together. Then learn about the patient's desired care requests. Then try to make the best decision I can with that information. I firmly believe in the importance of decisions made by the charge nurse, and I respect the position.
How do you handle unexpected circumstances like short staffing, unfamiliar treatments, etc.?
I take a step back, analyze the situation, and determine the most appropriate plan of action. If we are short-staffed and have to take an extra patient, I will modify my plan and focus on my priorities. If I have to give an unfamiliar treatment, I consult any available materials, such as nursing policies and procedures or manuals, and ask for help. Whatever the circumstance, I welcome a challenge and always make learning my main priority.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your role play. Don't worry if I stop you when the time is up.
Good morning, Mihiraa. I am Darren Sains, your attending nurse. How are you doing?
Good morning, Darren. I am good. Thank you for asking. How about you?
I am good. Thank you. Well, Mihiraa, I am glad to inform you that you are ready for discharge. And I am here to discuss the discharge plan with you.
Nurse, it is too early for me to get discharged. I am very much concerned about my care and support after discharge.
Mihiraa, it is quite natural to feel so. By the way, I would like to know the support you have at home regularly until you regain your independence.
Yes, I live with my granddaughter, and I have got good neighbors as well. But when they leave for studies and work, I will be alone.
All right, that is understandable. And may I know your concerns in detail about going home?
Well, nurse, I am really afraid of walking around independently and especially of falling over. I am not prepared to be discharged, nurse.
I acknowledge your concerns. However, the physiotherapist will provide education to you and your family. The physiotherapist will ask you to keep your leg elevated to reduce swelling. Also, an exercise regime will be instructed, along with information regarding your mobility in the present condition, so that you will be confident and capable of doing your daily living activities.
Oh, is it?
Yes, Mihiraa, try not to worry. It is under your satisfactory progress. The doctor has decided to get a discharge for you.
But nurse, once I am discharged, how will my wound be monitored?
I appreciate your consciousness. I will now outline the signs of infection, so that you can assess your wound appropriately and can contact your GP for assistance. If your wound has redness, your wound requires attention. Increased swelling or leakage from the wound should be taken care of at the earliest as possible. You can also seek GP's help to reinforce the dressing if necessary.
I feel a bit relieved now. Well, nurse, what about my medications, especially for pain relief?
Your question is reasonable. After getting the discharge summary from your doctor, the pharmacist will deliver medications before you are discharged.
Okay. And what about the injection? Is it necessary to continue?
Yes, it is absolutely necessary. Don't be overly concerned about administering anticoagulant injections. It will be demonstrated by a nurse first. Afterwards, you will be performing it under our supervision. Nothing to be worried about. It is not at all a difficult task. It is important to continue the anticoagulant injection for 10 days after surgery.
Okay, I hope I will be able to do that. Nurse, how to avail help if there is anything wrong?
Your concerns are quite sensible. Giving you the discharge means we are not leaving you halfway through your progress. Before discharge, you will be given proper instructions to take care of your wound dressing, and also the remedies you can take to have a faster recovery.
Good to hear that, nurse.
Nevertheless, you can schedule your appointment to see the GP when you feel it is essential to have a review. Is there anything else that I have to address for you?
All right, nurse. I understand that. In terms of follow-up care, when is it appropriate to make an appointment?
I appreciate your thoughtfulness. The follow-up appointment is vital, and obviously, several follow-up is needed in your case. The first follow-up is scheduled at 2 weeks, or earlier as required. Further follow-up will be scheduled on review. Mostly, follow-up may require up to 1 year after surgery.
All right, I got it.
Alongside, if there are any major concerns, such as excessive pain, despite taking medication, seek medical attention. Likewise, if you notice bleeding from the wound site, and an elevated temperature, or in case of any sort of difficulties, call the hospital for primary advice, and visit us for treatment.
Yes, nurse, I will. And how long will it take to heal?
Mihiraa, normally it will take 12 weeks for complete recovery. Make sure you follow the medications and our instructions properly. Along with proper diet and wound care, you can have a comfortable recovery period and a faster recovery.
All right, nurse. I understand that. I will take care of it.
Good to hear, Mihiraa. I hope I have cleared all your queries. I wish you a speedy recovery.
Thank you, nurse.
That is the end of your OET speaking role play. All the best.
Thank you. Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.